Thank you. First of all, let me say, by the way, I'm really pleased that this group is organizing itself. Generally, lots of people want to talk to people in authority and make complaints. But generally, if the work done suggests that there's been a lot of thought, then the so-called people in authority really should be listening. And I've looked at this document very briefly. It's very good. So I want to compliment the organizers. It may come as a bit of a surprise to you that I actually agree with quite a lot of what is said. So, I'm really pleased that this planning business is no longer being viewed as something where a planning commission talks to state chief ministers, government. It's not just a government activity. I think the whole idea of making the plan, 11th plan, an inclusive growth plan, was to do a lot of inclusion in terms of its objectives. And that is why, for the first time, instead of just saying the plan has a growth target, it does have a growth target. We also had 27 monitorable targets. I don't remember them all, but poverty reduction, IMR, MMR, enrollment ratio, gender gap. We had a whole list of things, access to water, etc. Malnutrition or extent of nutritional adequacy and so on. I mean, the purpose was, to shift the debate away from just the growth rate. When I walked in, one of the newspaper channels, or rather television channels, which are certainly represented here, the only thing they wanted to know was, what do I think the growth rate is going to be, which the CSO is going to announce tomorrow. Now, I don't think they asked me, what do you think is the literacy rate going to be? They didn't ask me what's going to happen to IMR. They didn't ask me what's happening to maternal mortality rate. They did not ask me what about undernutrition, but they want to know about the growth rate. By the way, that's good that they want to know about the growth rate, but that is about 3% of the total number of things we should focus on. So I'm glad that you are having this involvement. I compliment you. I'm glad that you produced a paper which is independent. It's not government stuff. But I think if you look at it carefully and ask yourself, how much of what you're saying does the government disagree? You'll find that we agree with a lot of what you're saying. By the way, we also disagree. So that, otherwise it's not very interesting. I mean, the only interesting issue I want to touch on is this deep suspicion of PPP. Okay? Now, I'm totally non-ideological about this, in the sense that I'm not suggesting. We haven't, by the way, said very much about PPP in the social sectors. On the PPP side, what we are saying is we have to give more to the social sectors. We also want infrastructure. I mean, we're not going to get growth, you're not going to get inclusive growth if you don't have infrastructure. And we think that if 100 rupees of government money can leverage another 300 rupees of private money, we can get 400 rupees worth of infrastructure. Or we can build 100 rupees worth of public infrastructure and you have 100 rupees worth of public infrastructure. That's the logic, really, of PPP. So now we say, what about the social sectors? Point number one is, I completely agree with the view that social sectors are fundamentally different from the hard infrastructure. So any simplistic extension of the hard infrastructure idea to the social is not actually correct. I would also agree with the proposition, by the way, that health is the area where the so-called market forces should be trusted the least. Okay, and we are agreeing again. Good. So we're not unaware of this. And I say this, I mean, these are tensions that we, as favored members of society, favored in the sense of being better off, we experience ourselves in relation to our own health. Forget about, take the group of Indians who do not rely at all on any government service and who are always going to private doctors. I think they ought to think also whether the market mechanism is providing them with good health service. Because this is a classic area of information asymmetry. You cannot choose intelligently if you don't know. And it's very easy for people to send you off to 50 different diagnostic tests just because you can afford it. It's not at all clear that you're going to get better treatment. We should recognize that progress is being made, even in health. I mean, after all, longevity is going up, IMR is going down, MMR is going down. The real complaint isn't going down fast enough. And I think that's a valid complaint. Please remember that, we talked about growth for years, and we didn't start getting it until the 1980s and the 1990s. It's now that we think we are a rapidly growing country, and we still have a lot to do to keep that growth up. But we spent 2 or 3 decades when we grew at less than 4%. And all that was happening was economists were talking about it. So don't be surprised if when policies shift to emphasize education or health, that it is going to take time. These are long haul affairs. I mean, when you talk about child nutrition, if women are going to get married when they're very young, if they're going to have children before they're actually physically mature enough to have them, because they get married very young, if girls' education is poor, so that knowledge is not easily transmitted to a mother, I mean, children are going to be born who are underweight, and if rural water is not very clean and if sanitation is not very good, the health condition of children is going to be bad, whether you give them nutrition or not. So really, you need an improvement in all these things. And it's sort of interesting that I often say that, ICDS is identified as the instrument to affect nutritional standard. It is one of 15 different instruments. And quite honestly, if you educate the women, don't get them married too early, give them clean drinking water and sanitation and abolish the ICDS, I guarantee you that child nutrition would improve enormously. And then ICDS would become less oriented towards nutrition, more towards preschool education, which of course is a permanent thing that one needs. So I think we have too much of in the social sector, the interrelationship between different levels and types of interaction is very important. I mean, when you're building a road from A to B, nothing else is relevant. You just go there with a bunch of engineers and a whole lot of cement and you build a road. But if you're going to try to educate a child or improve the nutrition of a child, it's a multi-dimensional intervention. And quite frankly, we don't always understand all that needs to be done in order to make it happen. So that's where I think active involvement with the experts, with the civil society, government, and everybody is really important. And I think this particular interaction and the work you've done, to my mind, is a very good example of constructive interaction. So let me thank you for inviting me here. Thank you also for doing all this work. And let me promise you, since my colleagues, the other members, have participated, I'll just ask them to make sure that when the midterm appraisal comes up, there's something in it